Assalamu alaikum. The long clinical consultation day. First scenario, Miss Samia, 35 years old, with a complaint of yellow discoloration of her eyes for 2 days. Please take history, examine the patient, and address her concerns. Ready, Dr. Ala?
Ready, Dr. Basim.
Yes, here you go.
Hello, I'm Dr. Ala. I'm the doctor in the medical outpatient clinic today. Let me confirm you are Miss Samia, 35 years old.
Yes, doctor.
Miss Samia, I am here today to discuss with you about your health condition and to examine you. Is that okay with you?
Okay.
It came to my knowledge that you have been troubled with yellowish discoloration of your eye. Is that right?
Yes, doctor.
Can you tell me more about it?
I feel this suddenly only 2 days ago, and I feel also
Mhm.
sick.
Yeah, I'm sorry for this, Mrs. Samia. And this is the first time to have something like this?
This yellow discoloration of my eye, yes, this first time to get like this yellowish in my eye.
Yeah, okay. And since it started, do you think it is increase or decrease or the same?
Same, doctor.
Okay.
Sometimes I feel it increase, but because from start it start suddenly by the same condition, but I feel little
Yeah.
increase. Yes.
Okay. And you told me also you feel sick. What do you mean by feeling sick?
Like I feel body tired also.
Okay.
Yes, body pain.
And this started also at the same time?
Yes, doctor.
Okay. Do you think this tiredness is related to specific time of the day, like more in the morning or more at the night?
No, 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 doctor. No, doctor.
This tiredness is with you all the time, or it's like on and off?
All time within these 2 days with yellow discoloration of the eye.
Mm-hmm. And this tiredness, do you think it's increased by exertion or not related?
No, 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 doctor. Not related.
Okay. Do you have any tummy pain?
Yes, doctor.
Where is exactly in your tummy?
In the upper right side of my tummy, I feel severe pain. Too much.
Yeah, I'm sorry for this, Miss Samia. So, when started this pain?
Together, doctor. At the same
At
day
the
of
same
this,
time also?
yes, at the
Mm,
same time, I feel my eye is yellow. I feel that this is pain, and also I feel my tummy is like distended. Also, I mean,
yes,
like yes,
yeah. And regarding this pain, if you can grade it from 1 to 10, how much you give it?
7, doctor.
Yeah, I'm sorry for this. So, do you need any painkillers now?
I am okay now.
Okay. Do you think this pain is moving to another part of your body, to like to upper thigh or to your back?
No, no, doctor. I feel it in the same side, in the right upper tummy.
Okay.
Yes, not
Uh,
moving any other.
yes. Can you describe me the nature of this pain? It's like dull aching, it's like or throbbing
Yes,
or pulsating.
yes, doctor. Dull, dull. This pain is dull.
Okay. And you told me also you have tummy distension.
Yes, doctor.
Okay.
All is together.
Start at the same time.
Yes, all these symptoms started only for 2 days. Suddenly, suddenly 2 days only.
Okay. Do you have any feeling sick or getting sick?
Yes, doctor. I tell you, I feel sick.
I mean, like feel throwing up or something. Like
No, 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 doctor.
any
I
difficulty of
didn't throw up.
swallowing,
No, no, no.
any change in your bowel motion, like loose motion or hard motion,
No, no, doctor.
any itching.
No, no itching.
Do you have any high body temperature?
No, no, doctor.
Any change in your body weight?
No, I didn't feel any changes.
Uh, okay. Do you have any sweat, excess sweat or night sweat?
No, 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 doctor.
Any lumps or bumps in your body?
No, no.
Do you have any history of long-standing disease I should be aware?
What?
Any history of long-standing disease I should be aware?
Long standing? No, no, no long
Mm.
standing. Only I
Mhm,
have before like 3 years ago, I have uh, clot in my legs, and also uh,
mhm,
at that time I admitted at hospital at that time and I
mhm.
given some medication, and I become okay after that.
Okay. Did you receive any specific diagnosis or any cause of this blood clot?
Uh, Doctor not mention for me any cause, didn't
Mm.
explain for me anything. But I
Did
have
you
this
receive?
clot, and also before also admitted also again another time in the hospital and given me blood transfusion because also I got also miscarriage.
Okay.
Doctor
Uh,
only tell me you have a blood, you have a clot in your blood channel at that time diagnosis.
okay. So regarding this blood clot, did you receive blood thinner?
I took one medicine, but I don't know. I don't know what is this. I don't know what is the name.
For how long you received it?
Uh, I received it from admission to the hospital, but I didn't take it regularly.
So you stopped
Uh,
it already?
I'm not stopped, but I'm not taking regularly every day.
Okay. Okay. So you told me also you had a history before of miscarriage. Can you tell me when happened?
This happened also like 2 years ago.
2 years ago.
Two time. One of them I tell you that I received blood transfusion for this problem.
Okay. Can you tell me at how many weeks or how many months happened this during pregnancy this miscarriage happened?
Happened two times.
Yeah, I mean, what was the age of the baby? How many weeks or how many months during the miscarriage?
Uh,
The miscarriage,
Early in the first
the
weeks
first.
of pregnancy. Yes.
Okay. Can I ask you about your period? Is it regular?
Yes, doctor. But sometimes it's heavy, but it's regular.
Okay. Do you take birth control pills?
Yes, doctor.
Okay. Uh, okay. Can I ask you, do you have any joint pain?
No, doctor.
Any skin
I didn't.
rash?
No, 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 no.
Any rash and
Anything
sun
like
exposure?
no,
Do you have any mouth sores?
no,
Any sores in your private area?
no, doctor.
Do you have any headaches?
No,
Any weakness in any part of your
no,
body?
no,
Okay. Okay. Do you have any chest pain?
no, doctor.
Any shortness of breath?
No.
Did you notice any change in your water work, like increase amount or decrease amount?
No.
Did you notice any change in the color of the water work, especially in the morning?
No, no, no.
Okay. Can I ask you, do you have any family history of blood clot?
Yes, doctor. My
Yeah.
sister before have the same problem, and yes,
Yes.
I have family history
Did
of
she
similar.
receive any specific diagnosis or?
I think doctor is tell her, but I don't know what is the problem exactly.
Okay. Okay. Do you smoke?
No,
Do you drink alcohol?
no.
Okay. What do you do for living?
I am teacher.
Okay. How much your symptoms affect your job and usual daily activities?
From I developed this now 2 days, I cannot do anything. I cannot go to my job also because I
Yeah, I'm
feel
sorry.
also, yes.
I'm sorry for this, Miss Samia. I hope I can help you regarding this by giving you the proper diagnosis and also the treatment for your condition.
Thank you.
Can I examine you?
Okay.
So I'll start my examination by checking the patient observation chart for the vitals.
Okay.
Then I
Uh,
need to check her hand. Okay.
okay.
The vitals, yeah, sorry. The
Normal,
vitals,
normal. Pulse and
normal.
blood pressure, normal.
Yes, okay. Temperature normal.
Yes. 37.
Yeah. Then I need to check her hand, okay, for any clapping,
Okay. No clubbing.
any koilonychia, leukonychia,
No. Nothing.
pulmonary edema,
No.
uterine contraction.
No.
Okay, then I will ask her to outstretch her hand also to check for any tremors.
Okay. Nothing.
I need to check the
Normal.
pulse.
Pulse is 72 regular.
Okay, I need to check the eye for any pallor, any jaundice.
Yes, doctor is jaundice. There is jaundice.
Okay. I need to check her mouth for any mouth ulcers.
No.
Okay, then I need to examine the lymph node for lymphadenopathy.
No. No lymph node.
Okay, then I will do a full abdominal examination after asking where is the site exactly of the pain. So she has pain in the right hypochondrial area. I after taking permission, if I can do superficial palpation and check the tenderness. She has tender in the right hypochondrial area.
Yes.
Okay, then I will do deep palpation for organomegaly and try to be away from this area. Okay, did it to check for organomegaly. If she has splenomegaly, if I can check the liver. She has hepatomegaly.
Yes.
She has
Liver is enlarged.
hepatomegaly.
Yes. Yes. Liver is enlarged. 7 centimeter below the costal margin. With the liver is bound is 15 centimeters.
Okay. I need no splenomegaly. Yeah?
No.
Okay, so I need to do percussion to check for ascites. Okay,
Positive.
and yeah, okay. Then I need to do lower limb examination for lower limb edema.
Little bit.
Okay. I need also to check the peripheral pulsations.
Okay. Intact.
Okay, and she has clot in the leg, but this was 3
Before.
years back.
3 years
Any
ago.
any swelling now?
Now, no. Now is okay. Receive medication for this
2
problem.
minutes left.
Okay, so can I know what's your concern, Mrs. Samia?
What I have, doctor?
I appreciate your concern, Mrs. Samia. Actually, from our discussion today and my examination to you, mostly you have a condition which is called Budd-Chiari syndrome. This condition related to formation of blood clot in one of the blood channels in your liver, which causing obstruction of the blood to flow from the liver. That's why it's causing accumulation of this, like we are calling the some materials which is causing this yellowish discoloration of your eye white and also causing the pain in this area and causing also the distension of your tummy. Do you have any other questions or concern?
It can be cured this problem.
I appreciate your concern, Mrs. Samia. Yes, there is a treatment for this condition, but we need to admit you to the hospital. We need to run for you some blood tests and do also some imaging for you to confirm our diagnosis. This condition may be related also to the blood clot that happened to you before and may be also related to the miscarriage. So we'll run also some blood tests to confirm it. Then we'll start treatment for this condition. The treatment mainly is by the blood thinner and also will involve a group of specialists if it needs any other intervention. Do you have any other concern?
Thank you, doctor.
Thank you. So we'll admit you to the hospital and then run the blood test and the imaging. Then we will come back to you also to tell you about the management plan.
Okay.
Okay.
Your time is up. The examiner question.
Present your case.
Today I saw Mrs. Sami. She's 35 years old. She presented with sudden onset of yellowish discoloration of jaundice and abdominal pain and also abdominal distension over the past 2 days. She has past history of DVT. She was prescribed anticoagulant, but she's not compliant with medication. And also she has a history of recurrent miscarriage. On examination, I could appreciate jaundice and hepatomegaly, which is 7 centimeters below the costal margin. And also she has ascites and she has lower limb edema. My first differential for this lady is Budd-Chiari syndrome, mostly related to an underlying condition of thrombophilia, mostly antiphospholipid syndrome.
Okay. Can you tell me what is the differential diagnosis of the condition?
Actually, the other differential, I think it can be other causes of obstructive jaundice, like gallbladder stone, although it will not cause this abdominal distension, the ascites and lower limb edema. Yeah.
Okay. Other differential?
Can be can be hepatic lesions like causing also obstruction like tumor or cyst.
Okay. Good. Okay. You know any other or that is all?
Yeah, I think that's all.
Okay. Can you tell me how we will investigate this patient?
So this lady, I need to admit her to the hospital. I will run for her blood test. I need to do full blood count. I need to do urea and electrolytes. I need to do creatinine. I need to do liver function test, LTST, and I need to do bilirubin, total direct and indirect bilirubin. Also, I need to do for her abdominal ultrasound and hepatic Doppler. For the thrombophilia screen, I need to do for her antiphospholipid screen, lupus, anticoagulant, anticardiolepin antibody, and anti-beta 2 glycoproteins. Also, we can screen for familial thrombophilia because also she has family history. Can check the protein C and protein S and antithrombin 3 and factor 5 also.
Okay. Okay. Can you tell me how we will manage this patient?
So this patient need to be admitted. We need. I will education and the counseling about her condition, and also I will involve a group of specialists, including the gastroenterology and also the specialized nurse, and also maybe interventional radiology. The main line of treatment for this condition will be through therapeutic anticoagulation. But if she is not responding to the treatment, maybe she need intervention, either by intervention radiology through something like thrombectomy.
Mm.
and also
What surgery?
supportive treatment.
What surgery can be done?
I think thrombectomy. She can do thrombectomy by interventional radiology.
Okay, it is angioplasty or stent because this is the clot.
Yeah, it's a clot. Yeah, interventional radiology. They can do either intravascular thrombolysis.
Surgery maybe in
Yeah,
these cases.
and
Some.
also thrombectomy. I don't know if they will put it, angioplasty or no, stent.
Yeah, yes, can be done if not improved by anticoagulation and also diuretic to relieve this ascites and edema. So
Yeah,
if not improved, we need to go
supportive
for
treatment.
surgery. Yes, and supportive treatment. Okay. Okay, thank you.
Okay, time is up.
Different.
You can comment now.
I think done perfectly. I feel only differential mentioned two, I think. Only just this. Otherwise, everything is good. Because also differential can be right side heart failure because this patient has ascites, has lower limb edema, standard hepatomegaly. So this can be right side heart failure as a differential diagnosis. Can be currently active hepatitis, but against that no fever. Can be can be even hydatid cyst or amoebic cyst also. Other can be also cancer, as you mentioned.
Liver
Yes, that is
abscess.
all I think.
Yeah, liver
Can be,
abscess.
yes. Can be liver abscess, yes. Hydatid cyst, amoebic cyst, or liver abscess.
Okay.
Yes.
So you want to give all marks except the differential?
Yes.
Because he give only 2.
And differential, -1 only. Differential.
Okay,
Otherwise,
and you can ask Dr. Ala what differential you want me to give. Is it for the clotting, thrombophilia, or for the manifestation, or for the diagnosis? Okay.
Yes, yeah.
Yeah, sometimes they want to give the causes of thrombosis.
Yeah,
Why
sometimes
thrombosis?
sometimes when I find the case like crystal clear in front of me, the differential disappears from my mind.
Yes.
Yeah, that's a problem. Yeah.
And you mentioned a group of specialists, and instead you have to say MDT,
For
right?
the examiners.
Yes.
Yes, yeah.
Consider include a group of specialists.
Yeah,
And you are talking to the medical examiner.
yes.
So MDT is enough or multidisciplinary team approach. You must mention it, not as a group of specialists. Anyway, they can accept. It can be accepted, but try to mention it as MDT. Okay. So for me also, the finding, you pick up the finding. The examination steps
yes,
also
yes,
was
yes,
systematic. The clinical communication perfect from
yes.
the start. Did you ask about short of breath and awareness of heartbeat, chest pain?
Yes,
Yes.
yeah.
Perfect.
In
Urine.
investigation, you mentioned Doppler ultrasound of the hepatic vein.
No, he didn't
So,
mention imaging.
you
No, I
mentioned
mentioned.
MRI angiography or CT angiography.
No, I mentioned only the ultrasound and the Doppler, the hepatic Doppler.
Okay, you need to mention MRI angiography, CT angiography, and this for this case mainly is specific test is three tests: Doppler ultrasound of the hepatic vein, MRI angiography or CT angiography, and thrombophilia screen. Otherwise, you can mention the routine investigation.
فينوغرافي صح؟ فينوغرافي MR فينوغرافي أو CT فينوغرافي.
Yes,
مو صح؟ لأنه هيباتيك فين.
yes. MRI venography, CT or MRI or CT venography.
Yeah, so don't forget the imaging, what we want to say. Okay, Dr. Ala?
Yes, okay.
Just one thing, also don't forget to include بالinvestigation something related للدifferential. I mean PMP is wisely, it should be done. LFT, better to say LFT with synthetic function. You need the coagulation profile, you need albumin. And also don't forget الفيرال hepatology الفيرال الفيرال
Serology.
serology, yes. الفيرال
Yeah.
serology panel should be done in any case of jaundice. Okay?
Yes.
So include those because they are part of your differential and they are part of the workup for jaundice. And also it's very wise whenever you have jaundice to say blood film. Okay, I know
Yeah.
that sometimes, because it's sometimes you need to include investigation related to the stem. And you have a diarrhea, you will say stool analysis. You have jaundice, you need something related to blood film, hemolytic workup, if it is a differential. And also, since also the liver is included, the viral serology is important. PMP is important because congestive hepatopathy is a top differential, along with LFT with synthetic function. This will make a difference because the liver is involved. Okay.
Yes. Yeah.
Yeah, perfect. And the perfect thing, Dr. Hind, he mentioned all investigation for clotting factor
MashaAllah, yes,
disturbance.
that's why I
Yes.
didn't say anything. He said
Yeah.
antithrombin and protein C,
Yes.
protein S. He said everything. So this was a good thing because you have a Budd-Chiari syndrome and you want to find out the thrombophilia. But always remember that if you have a very lengthy investigation panel and you don't know what is the exact cause, so you can say thrombophilia screen, especially that you need to give time for other investigation. And if the examiner is interested with the thrombophilia causes, he will tell you, what do you mean by thrombophilia screen? What do you mean by virology screen? What do you mean by, for example, anything you mentioned as a screening workup? So he will ask you for a detail just in order to save your time, because in this case, you have really a lot of investigation to be done. You want to list things quickly. And don't waste your time enumerating the thrombophilia screen. So mention, I would do thrombophilia screen if indicated. I will do virology screening because it's one of the differential. So try to use this. It's also save your time and it will give the proper impression to the examiner that you are including this in your differential.
Yes.
Yeah. Hepatitis, viral hepatitis also can cause tender liver. So as Dr. Hind mentioned, you have to do the screening for virology. Okay. In particular, hepatitis A as acute one.
Because
Don't,
I think his jaundice is 2 days, right?
yeah, it's 2 days only.
Yes, AE, all of them are important. And don't forget that the chronic one can lead to acute hepatitis. And he could be in the seroconversion or the acute state of hepatitis. We catch it. Sometimes it is manifesting itself in the acute phase. So acute hepatitis can be the acute phase of chronic and can be the acute phase of acute hepatitis. All of
Yes,
them are
exactly.
valid. All of them are valid.
Yes, you're right.
بس if he don't have a risk factor you will say it
Mhm.
مع الاستحياء لأنه you don't have a risk factor, no blood transfusion, no vertical transmission, no risky behavior.
Yes, the travel history is important. I don't think if he asked, did you ask Dr. Ala?
No, I didn't ask.
It's important
no,
for
no,
me,
no bowel motion, no fever, so I didn't
but
ask about it.
still you are suspecting like hepatic abscess.
Hepatitis, yeah.
Yeah, hepatitis A. So if you have travel history positive, don't forget to ask about the food. It's one of the hidden parts you have to explore. Whenever you have GI symptoms, they like to ask about travel. Diarrhea, jaundice, hepatic, all the GI system, it can be related to travel, directly or indirectly. So they like to ask about travel history. Don't forget it. You screen everything, but you miss this part as the
Yeah.
travel history. The HIV and risk habit also, don't forget them. Okay. You ask for the
Alcohol,
best.
especially any binge drinking. Any acute binge drinking can bring the patient into an acute
Alcoholic hepatitis.
yes. So alcohol, especially in a recent attack of binge drinking, can make things worse over short time. فالalcohol, الترافل والrisky behavior, it is related to the case of jaundice more than related to the cause, which you pick it up later on. Okay, don't think that if I pick the cause, I can now cut things out of my history. No, still jaundice is an important, يعني it comes with its group of questions that are written in the communication, and you have to fulfill them. As Dr. Bassem said, any case of GIT, fever, diarrhea, jaundice, even cough, because you have the typical and atypical pneumonia, it's not, and they will never forgive you if you didn't ask about travel. Don't forget in malaria or some infections can cause hemolysis and can put you at risk of jaundice. So you don't know, and it need to be asked early كمان. ما تتركها لتحت يعني after the systemic review or later on after the social. It's very wise to be asked early. You need to give it an importance in jaundice cases.
Yeah. Let's say also the approach you started was perfect. You pick up the finding from the start. When you ask about past or long-standing disease, and she was volunteer to say, not volunteer, but you try to dig the hair, and she said, yes, I have clotting. The travel history here is important to roll out DVT, okay, if there is long travel, and also for the infectious cause. So don't forget the travel history. It's something might explore a lot of things in the case. It can give you the clue for the case, and it might also you might miss the case if it was related to the travel. Okay, LDH also one of the hemolysis workup, as Dr. Hind mentioned. Add to this the last thing I want to add, the itchiness. It's important to ask whenever you have jaundice, and you did this. So I can give you the 4 mark, 2 marks mainly for, or maybe for the differential because you kept quiet, but try to find differential for every symptom and complain. As I said a couple of days ago, the common presentation you have to have differential diagnosis for each. You train yourself for it. Abdominal pain differential, acute and chronic. Jaundice differential. The cough differential. Diarrhea, chest pain, headache. You have to be ready for those things. Joint pain, back pain. Okay, put it in your note that I have to have some differential in my mind to be ready to mention it because I will have these complaints mostly in your exam. Okay, there is question from Dr. and Aman. I'm Sam. I cannot read the name. Anyway, sorry if I pronounce your name wrongly. I think in case of jaundice and GI systemic review, we should ask about hematemesis, perfect, and melena, also in CNS confusion and fits. So either in the examination, you offer the digital rectal examination, or you can ask in the history any blood coming from any area. I think also it was missed, but Dr. Ala didn't think about it because it was short acting. Sorry, it was acute onset, 2 days only. But it doesn't also rule out this manifestation. So you have to have the approach in your approach whenever you have GI question or GI system review question, add to them upper or lower GI bleeding. Okay, Dr. Ala? It was negative in this
Okay,
case.
Dr. Basim.
Yes.
Yeah.
Yeah, it was negative in this case, but it might come in other case. Like as Dr. Hind mentioned, chronic hepatitis with decompensation. But I think you can catch the case whenever it comes as a chronic one. So you will add this question definitely to your the anemia as well. Pallor. Anyone told you are paler? If you have dizziness when standing from sitting position. Anyway, you manage the time properly. You did everything. I cannot minus you unless for the differential. The yeah, your scenario, Dr. Selma. Miss Lisa Martin, 30 years old. You are the doctor working in the medical admission unit, presenting complaint abdominal pain. Good to be in the same system. So GI question and GI system. Lisa, lady presented with abdominal pain associated with tiredness, generalized malaise for the past week, 1 week. Vital signs, blood pressure normal almost, heart rate 92, temperature 37.7. Whenever you're ready, Dr. Salma, let me know.
Okay.
Anyone has a question for the previous case? Any adding comment?
بس اتذكرت إنه sometimes it's important to ask about confusion لأنه you have a acutely deteriorating liver في الانكفالايتس مو الانكفالايتس الانكفالوباثي. So you need to just add one of the red flags that have you ever been confused أو reversal of the sleep cycle, like you're sleeping in the day, sleeping at night. So these things really help just to include the encephalopathy.
Yeah, but he remembered the tremors, which is good also in the case, in the examination.
He asked them.
Yeah, he asked about tremors, which is very important in this scenario. Yes.
Tapping tremor.
Mhm. Okay. Any other question? I'll try to systematic answer or investigation, put it as systematic investigation, starting from the lab workup. As I said, usually it's general, specific, bedside, imaging, and invasive. Okay.
Okay, Dr.
So
Bassem.
you'll not forget any of them. But if you start to mention the lab workup, you will forget the imaging. And if you start the general, you forget the bedside, for example. And we don't want to miss any of these. Okay.
Yes. Yeah.
Okay. Waiting for Dr. Salma. Whenever she's ready, we will start the second scenario.
Okay. Hello.
Ready?
Yes, you can
Yes,
start.
ready.
Hello.
Hello.
I am Dr. Fadil. I'm doctor in the clinic today. Can I confirm your name and age, please?
Liz Barton, 30 years old.
Today we are here to discuss some issue related to your health, examine you, and address your concern. Is it okay with you?
Yes, doctor, it's okay.
Okay, thank you. Before we start, can you tell me what bring you to the clinic today?
Actually, doctor, I have this tummy pain, which is very annoying, and also I'm feeling tired.
Okay. Okay, tell me more about it. For how long?
It started 1 week back. I had this tummy pain. I tried some painkillers, but it's not that helping. And also, I'm feeling more tired day by day.
Okay. Can you tell me what is the side of the pain in the abdomen, in your tummy?
All over my tummy, doctor, but it's more in the lower tummy.
More in lower tummy, right side or left or both?
Both sides, but it's lower, but more in the lower side.
Okay. Can you tell me the character of this pain? It is dull, it is cramming, it is
Yeah, it's like cramping.
okay. Going to any place or in the same place?
No, doctor.
Localized in the same place.
Yeah, it's not moving. Yeah.
Okay. If I give you a score from 0 to 10 for this pain, what grade for this pain? For
Yeah.
1 for minimum and 10 for maximum.
You can say 6 to 7, doctor.
I'm sorry for that. You want me to give you any now painkiller?
Yeah, please, doctor.
Okay, we can call nurse to give you paracetamol as a painkiller.
Thank you.
Okay. Can you tell me this tiredness is together with this abdominal pain?
Yeah, I started to have this tummy pain, and the tiredness also came with it. Yes.
Okay. All day, this tiredness all the day or only in the beginning of the day?
No, doctor, it's like most of the time with me. Yeah.
Okay. Okay. Can you tell me, please, what other condition associated with, like, you feeling throw up with the tummy pain?
No, doctor.
Any loose motion?
Yes, doctor, I have loose motions.
Okay, can you tell me more about, please? How many times per day?
It's like 6 to 7 times, doctor.
Okay. Is there any dryness in your mouth or any dryness in your skin?
Mm, my skin, I don't know, but yeah, I feel myself dry. Yeah.
Okay. How do you compensate for this loose motion?
Yeah, I'm trying to drink more water, doctor.
Okay. Is there any blood with this is loose motion?
Yes, doctor.
It is bloody hole or at the beginning?
No, sometimes I notice blood with it. Yeah.
Okay, sometimes, not at all.
Yeah.
Okay, okay, okay. Is this difficult to flush or watery, or can you tell me about consistency? Is it
No, doctor.
difficult to flush?
No,
Bulky?
it's no, it's liquid, doctor, and I can flush, no problem.
Oh, okay, 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 okay. Uh, uh, okay. Can you tell me, you have any high body temperature?
Yes, doctor, I feel myself warm.
Okay. Same with the same time, always within 1 week?
Yeah, this all over this week also.
Okay. Is there any weight change?
Yes, doctor, I'm losing weight. Yeah.
Okay. How many kg over how long?
Actually, doctor, I'm not measuring, but over the past few months, I feel my clothes becoming loose.
Okay. Okay. Uh, okay. Is there any lumps or bumps in your body?
No, doctor.
Is there any loss of appetite?
Yeah, somehow.
Okay. Okay. Is there any other past medical history should be aware of?
No, doctor.
Okay. Within these 2 weeks, you didn't seek medical advice for this problem?
No, doctor, started 1 week only, 1 week back, but I
Okay,
didn't
one
seek
week.
medical
Okay,
advice. No.
okay, okay. You didn't have any family history of similar condition?
No, doctor.
Okay. Okay. Is there any shortness of breath?
No, doctor.
Okay. Any feeling of heart racing?
No, doctor.
Any coughing or coughing up of blood?
No.
Anyone notice you that you are paler than before?
Yes. Yeah. The some my friends are telling me like this.
Okay. Okay. For the same time.
No, since long time they are telling me like this.
For this balar for how long? Long time before this 2 weeks? For this 1 week?
Yeah. 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 For this 1 week. Yeah.
Okay. Can you tell me for how long, please?
Over the past few months.
Okay. And for this problem, you do any investigation
No,
or you
doctor.
seek any medical advice?
No.
Okay. Is this loose motion related to any type of food?
No.
Okay. Okay. You have any travel history?
Yes, doctor. I went to Madagascar 2 weeks back.
Okay. Before 2 weeks, you came from this area. You take a local food?
Yes.
Okay. Okay. And this symptom is started 1 week after came back from.
Yeah. It started like 2 days after I came back with this loose motions. Yeah.
Okay. 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 Is there any during your travel? Is there any? Sorry for this question. Is there any unsafe sex?
No.
Okay. Okay. Um, Is there any change in your water work?
No, doctor.
Okay. Fluid urine or different urine color?
No.
Any headache?
No.
Okay. Any feeling of blurring of vision?
No.
Any memory problem?
No.
Okay. Um, okay. What do you do for living?
Actually, doctor, I'm a secretary.
Okay. Okay. Is this symptom affect your life?
Yes, doctor, I'm feeling too much tired and this pain is agonizing me. I didn't go to work also over the previous days.
Okay, I'm sorry for that. So we can give you sick leave until we fix your problem.
Okay, doctor.
Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. Okay. You tell me that you have no any other past medical history should be aware of. If you
No,
mention,
doctor.
if you remember any other past medical history you mentioned.
No, doctor.
Now you took any medication?
No.
No any medication now on it.
No, some painkillers only for my tummy pain.
Okay. 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 Can I examine you?
Yes, doctor.
Okay. I will start by general examination. Hand.
Okay.
Yes.
The hand. Mm,
I will check hand for any changes in the hand, palmar erythema,
No.
nothing. Any
No.
leukonychia.
No.
Okay. I will check pulse and blood pressure.
As
Blood pressure.
outside. Yeah.
What?
As outside. The blood pressure
Okay. Okay.
110.
Same.
Yeah, right. Yeah, same.
No no botchural drop if I check it in standing sitting.
No need.
Okay. Okay. Uh, okay. Then I will examine eye for any pallor jaundice.
She has pallor.
Okay. I will examine mouse for any
For what?
mouse ulcer.
Yeah, she has mouth ulcer.
Okay. And okay. Uh, is there any abnormal mouse hygiene like
No.
candidiasis or whitish?
No.
Okay. 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 Sorry for this question. Is there also genital ulcer or only in the mouse?
No, doctor. These sores are coming in the mouth only. I don't have in my private area.
Okay. Okay. So I will examine abdomen.
Mm-hmm.
Okay. Or superficial palpation.
Okay, she has tenderness.
يعني I will tell in detail. I will firstly I will inspect abdomen. I will stand at the end of the bed. I will see for any if
Okay.
there is any scar, any masses.
No, no,
I will ask the
nothing.
patient give me cough,
Okay.
give me deep breath.
Okay. Nothing noticeable.
Okay. Then um, I will examine for any organomegaly.
No, she doesn't have organomegaly.
No organomegaly.
No, she has tenderness all over her abdomen, more at the lower side.
Okay. Okay. Tenderness in the lower part of the abdomen.
Yeah.
Okay. Okay. Then I will check if there any edema, lower limb edema.
Mm, no.
Okay. Okay. If there is a time, I will examine first and second heart sound.
2 minutes left.
Normal.
Okay. Normal. No any murmur.
No.
Okay. 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 Can you tell me what is your concern?
What's wrong with me, doctor? Why I have this severe tummy pain and this loose motion?
From what you said to me on after I examine you, with presentation of the tummy pain, also tiredness, and this loose motion with bloody loose motion, and also some pallor, um, um, with a positive travel history before 2 weeks, I can put like you have got some bacterial infection, maybe related to your travel because of taking some local food. So I will put maybe um, maybe infection, but I need to proceed for some blood test. And after that, I will sit with you. I will tell you more about diagnosis and plan of management.
Yes, doctor. But doctor, I had my friends, they were with me also, and they ate with me in the same restaurant. Actually, they had also loose motions, but they improved. That's why I was wondering why I didn't improve and they improved.
Yes, I'm sorry for that. Highly appreciate your concern. But everyone is different from each other, and maybe also you have underlying also previous problem, maybe not related to your travel, because you have also pallor for few months before uh, before this is problem is start. So I suspected maybe this is maybe also now you notice that you have a bloody stool, but maybe this is blood for a long time and it is hidden. You cannot see you by inspection in the stool. What is called is yes, this is hidden blood, can be detected only by investigation, and maybe have also condition called ulcerative colitis. Don't bother by this name. It is a condition which defect in on your defensive system instead of killing bug, it attack your bowel. Is a highly suspicious diagnosis, but I need to proceed some investigation to confirm the diagnosis and sit with you again.
Okay,
Okay.
time is up. I added 1 minute for the last concern. Now you can start the exam question, Dr. Ala.
So can you present your case and put your differential?
Okay. Okay. The gentleman presented with tummy pain for 2 weeks, for 1 week, associated with tiredness. Tummy pain is associated with loose motion, associated with diarrhea or diarrhea which is bloody. Okay, 6 to 7 times per day. There is also fever and weight loss, and there is also pallor for a few months ago with a positive travel history 2 weeks ago. So um, I need to. So my differential in this case maybe as a long condition of pallor, maybe ulcerative colitis, maybe inflammatory bowel disease, and maybe also related to travel history also. Yes, maybe bacterial or parasitic infection.
Yes.
Yes, maybe something caused blood diarrhea like Shigella or yes. Also
Yeah,
in
any other
maybe can
differential?
cause also maybe related to travel
Yes.
diarrhea like maybe like Shigella, Campylobacter. Maybe also in Amoeba histolytica can cause blood diarrhea. and maybe also ulcerative colitis, inflammatory bowel disease.
Okay.
Okay.
Any other differential? Anything can comes to mind?
Can be celiac disease, but again, is that not related to any? Uh, this diarrhea is not related to any type of food.
Mhm. Okay. So what you are going to do for this lady?
We will do routine investigation, full blood count, renal function test, liver function test, inflammatory marker, um, and also abdominal ultrasound. We need to do also stool culture, uh,
Mhm.
stool routine and stool culture, and also blood culture. I need to do
Okay.
also fecal calprotectin uh,
Okay.
to exclude other inflammatory bowel disease. If it is positive, we can proceed for other tests like biopsy
Mm.
from bowel.
How you will take the biopsy?
Hello?
How you will take the biopsy?
Through endoscopy. We will do
Yes.
endoscopy. Yes, we'll do
Yeah.
endoscopy.
Any other test you want to do?
Mm,
Okay.
what
So
we can-
what's your management?
We'll we'll admit the patient.
Okay.
We'll do after full investigation. We will educate the patient about the condition and counseling, and we need also multidisciplinary team approach.
Mhm.
Yes. Uh, and
What will be your
we
team?
will give paracetamol for fever. Team we need to involve gastroenterologist
Okay.
and a specialized nurse and
Mm.
also hematologist and um, hematologist.
Mm.
Then uh, mm, then we'll give
Any
also paracetamol
specific
for
treatment?
fever. Then if there is any, if investigation show it is a flare of like any inflammatory bowel disease, we can
Mm.
give accordingly.
Mm.
Accordingly, yes, we can give steroid like
Okay.
hydrocortisone 100 milligram every 6 hours until settle the condition. Um, then, according to the case, we can give oral also steroid.
Okay.
Uh, yes.
Okay.
Then after that, if not improve, we can go to infliximab and other biological therapy.
Mm. Okay.
Okay, time is up. Your comment, Dr. Ala, please.
Okay. Thank you, Dr. Salma. Well done. But only one thing that
والله not
like
well
made
done. I feel it.
no, you are it's good. But the only one thing like made you miss the diagnosis or miss the case. One question only. You should have asked it from the start. This is the first time you have something like this, or you had before?
Mm.
One question only. She will tell you that she had this tummy pain before, many times before. She had these loose motions also before. So one question only, it will elicit the diagnosis in your mind. You reach the diagnosis from her, like the pallor that she told you over the previous months, and also the loss of weight. And when she raised the concern about that she didn't improve. So one question only, it could have helped you to figure out her underlying condition.
Yes, yes,
Okay,
yes.
so don't forget it. This is the first question you should do for any symptom, like patient presenting with any symptom. So you should ask: is the first time or you had it before?
Yes. Important.
Okay, so this is the thing that in the communication. So also in the travel history, you asked
Need more history. Huh?
yeah,
I need to ask
yeah,
more about this. I know. Yes.
needed
Yes.
more
Tell me.
detail. Yeah, for how long you stayed there. You
Mm.
asked only about the street food. You should ask also any contact with sick people. Okay, especially one of the differential diagnoses here also is TB enteritis. Okay, especially with positive travel history. So you should ask also any contact with sick people. The vaccination, she received vaccination before, during, and after. Okay, she took vaccination. She ate from street food. You should ask also with whom you stayed. They ate with you. She mentioned to you at the end with whom you stayed. She ate with you. She had also this loose motions or no?
Mm.
Okay, this is from
Okay.
the travel history. You didn't ask any female history also. You didn't ask her about the female history. So this is in the communication. In the
Mm.
physical examination, you asked about the dehydration, the dryness in the history, but you didn't assess in the examination. You should also assess in the examination.
Mm.
Okay, that's good. You asked also about the blood pressure sitting and standing. Okay, for the volume loss. You should also assess for dry mucous membrane for the dehydration. And also you should examine lymph nodes. Okay. And sorry, in the travelers, you asked already in the travel in the risk behavior, yes. And the lymph nodes should be checked. Okay. And you should offer digital rectal examination.
Yes.
Okay. Any bloody diarrhea, you should offer digital rectal examination.
Yes.
Okay. This is in the examination. Your differential was good. You can add only TB enteritis, but again, it's that the patient there is no history of contact with patient with tuberculosis. But the other differential you put, it's okay. In the investigation, also you put good workup, but only remaining X-ray abdomen. You should do X-ray
Yes.
abdomen, yeah, to
For
check for
dilated colon. Yes.
yeah, to
Yes.
check
Any
for
colon
the
dilatation.
to check
Mm.
for the complications. Okay.
Okay.
For the management, the multidisciplinary team should be the gastroenterologist, specialized nurse, and you can also involve the surgeon.
Okay.
Okay. Not hematology, but I don't know why you involve with the hematology in this case.
Yes, because of Palar like this to check for this anemia.
Anemia. Okay.
Yes.
Okay. And the management also, this patient needs resuscitation. Okay, she is dehydrated, she has severe diarrhea, and she is dry, so she needs resuscitation. You should start management with resuscitation with IV fluids. Okay, if she in flare, as you have mentioned already, corticosteroid, and also you should mention also according to the result of the stool analysis and culture, if there is infection, we can treat it with antibiotic. Okay, other treatment for the inflammatory bowel disease according to the result of the colonoscopy, as you have mentioned, either colonoscopy or sigmoidoscopy, and the further treatment based on the result after this, in between attacks, I mean. Okay.
Okay. Thank you.
Okay, thank you, Dr. Salma. It's very good. Your performance is good, but only this one question only that made you miss the patient from the start.
Yeah, thank you, Dr. Ala. I think also I agree with your comment regarding clinical communication. A lot of question missed. However, she covered most of the approach from the start as analysis of the complaint, analysis of the relevant system. But if you can remember, the last question before starting, the second scenario was about blood, passing blood. I think you asked this during the area, right? You have to ask more about this blood amount. Is it more? And to know, is it something serious? Because you could put cancer colon here as a differential, right?
Yes, yes, yes.
Yeah, and I think supposed to be asked as a concern, is it cancer, doctor, from Dr. Ala? And you can put it in your differential. Apart from this, the approach, as Dr. Ala said, the first time or previous. It's a very important question. Any acute onset complaint, you have to ask about previous attack. Cough, fever, jaundice, chest pain, because you might have something recurrent or coming and going, and it will change your diagnosis totally. Like our scenario today, you can put traveler diarrhea in your top differential because of the travel history recently. However, there is past history of the same diarrhea, and you can change the diagnosis to another inflammatory bowel disease. I like also if you ask about stress. However, it's the stress and the irritable bowel syndrome. It will not be fitting because there is blood, there is a loss of weight, there is also tummy pain. Tummy pain can be also with the irritable bowel syndrome, but there is mouth sores, and because of mentioning mouth sores, do you think the ulcerative colitis can be the diagnosis?
Yes, yes, maybe. Yes, maybe the
Uh,
differential
no,
can cause.
it's more with Crohn's disease.
Yeah, ulcerative
Yes,
colitis
because ulcerative
confined.
affect to rectum only.
Yeah, confined, not the rectum,
Yes.
the colon. Okay,
Yes, but also uh, it's
confined
very
to the
rarely
colon,
common. Yes, Crohn's disease is not coming with blood.
but
Ulcerative
it
colitis
happened.
mostly bloody.
Yes, you're right, but it happened. But
Okay.
the ulcers or mouth ulcers only appear with the Crohn's or celiac or other
Yeah,
differential basis. Yes.
Yes, yes,
yes, because if you ask it here, she will tell you that before she has loose motions, but it's not that bloody. And sometimes it's come with blood, sometimes no. And this time only this she had this severe blood with the stool. So this is like she came with flare this time.
Hmm.
Yeah,
Yeah.
and maybe precipitated with the infection she got while traveling also.
Yeah. The good thing here, Dr. Ala, she asked about the diarrhea, the relation to food, but the frequency. Did you ask for how long? Frequency. How many times per day? And you notice, which is good also, you notice that he is dry.
yes.
He
It
told you yes.
mentioned six. Yes, mentioned 6 to 7
Okay,
times
mention.
diarrhea,
Oh, okay, so that's why you ask
and it
about
is bloody.
the compensation. Perfect. You ask about the
Yes.
compensation and the dehydration sign. Do you feel thirsty? Do you feel that the water work less? Because also can be an AKI, and the urine output might be reduced. So this is regarding the diarrhea and the analysis of diarrhea in relation to the food. You remember later on, but at least you ask. Whenever you have travel history, as you ask about the food, from where is it, local restaurant, is it from the hotel, you have to ask about, in particular, Africa, you have to ask about vaccination before and during and after. Okay. Prophylaxis, did you take your prophylaxis before traveling? Are you compliant? Because you can suspect malaria for any manifestation mimic to this today. Okay. The other thing, if you suspect dengue, skin rash, you can ask about it. Any prophylaxis for the mosquito bite, you have to ask also. If you suspect malaria and dengue fever, hemorrhagic fever, but not our case today. Okay, back to the travel history, where you have to ask about, for how long, who's with you, and anyone in your journey had the same. Because if something happened with others, you can suspect traveler diarrhea. If not, you have to search about other cause. Okay, this is regarding the diarrhea and the analysis of the diarrhea and the approach of diarrhea. The blood is important to ask because you can even specify the travel diarrhea with blood, as you mentioned, Campylobacter, E. coli, Shigella. The other thing for the diarrhea, the flushability, you ask already. Is it flushable? To rule out celiac and malabsorption diarrhea. The GI already done as a questions. Then the other systemic review, you remember the systemic review or the system of the CNS later on, which is, it's okay. I prefer to imagine the body in front of you, the head down to the tube. Ask in this way. So you not miss the CNS. You didn't miss, but you make it as last one. Anyway, better than forgetting at all. Skin rash important to ask. The important system here you missed the female history. Okay, whenever you have female history or female in the childbearing age, you have to ask about three things, three P's as you usually say: pregnancy, pills, and period. Don't forget them. The do you question you ask already. Travel, sorry, smoking, alcohol. And as Dr. Hind said earlier, whenever you have alcohol and he is positive taking alcohol, you have to ask about binge drinking in case of liver disease as the first scenario. But today it was generalized abdominal pain. The painkiller you offer, the site, the onset, the radiation, everything went perfect. One jargon you mentioned during the history, I forget now. Maybe you mentioned diarrhea, but there is something else. Dr. Ala can remind me what was the jargon she said.
Abdominal,
Okay,
abdominal
abdominal pain,
time,
something else.
and genital. I don't know if genital.
Yes, genital, perfect. Yeah, genital.
Mm.
So private area. And Dr. Ala corrected you. If
Yes,
you want
yes,
to ask about, yeah, you have to say a genital area sore.
private area.
Or,
Okay.
sorry, a private area store. Don't say genital, okay? The
Okay.
risk habit, you ask about any unprotected sex, which is also perfect to rule out other infectious diarrhea like the HIV. And by the way, you can add it if he has any risk or she has. And by the way, you mentioned at the presentation, I examined this gentleman. Of course, because you are not saying a patient, but she's a female. Don't mix. Okay, take
Yes.
care of this. But if you're in the exam, you will, because you are seeing a patient, so you'll say, I examined this lady. Okay. The differential, let's go to the differential of this scenario. Traveler, inflammatory
So
bowel
I forget
disease.
female history, because in
Yeah,
my mind I forget. I
this is
think
male.
this is my. Yes.
It's okay. So back to the differential, traveler diarrhea, inflammatory bowel disease. Based on the previous diarrhea, you can put it in the first. And the last will be cancer colon. Why? Because the patient is having loss of weight, loss of appetite. You can put it as a differential and you want to roll it out. Okay. The investigation, fecal calprotectin you mentioned as a diagnostic one, specific, I mean. The anemia workup you have to do. As long as the patient is having diarrhea with blood, yeah, I should start doing the CBC to rule out anemia and inflammatory markers to rule out infection. ESR CRP could be high because of activation or the flare up of the disease. And the stool analysis you did, stool culture. And the other screening you can mention also for traveler diarrhea, you can put it in your panel. Along with the imaging, X-ray, abdomen, erect, and supine, as Dr. Ala mentioned, you have to mention invasive. The last test you will do, colonoscopy. Okay, if need, you can take biopsy. The examination step, apart from lymph node, perfect. Whenever you have, whenever you have diarrhea or infection, you have to examine lymph node or to offer examination of lymph node along with the digital rectal examination in our scenario today. Okay.
Okay. Okay.
Yeah, otherwise I think you can gain good mark. As I put for you, 22 is good. Even 20 out of 28 in long, it's good. You have any question?
Thank you.
Yeah, rehydration is important. Admission, I like when you say I admit this patient. Why? Because of the frequency of diarrhea, patient is dehydrated, patient is having bushra hypotension. All of them as are indicated or indication for admission. The hydrocortisone you mentioned is very important whenever you have flare up of inflammatory bowel disease, but you have to roll out infectious cause. You cannot give a steroid if you have infectious diarrhea. So I have to roll out infectious diarrhea, then I will start managing as inflammatory bowel disease flare up. Okay,
وما ننسى نعطي PPI وبون بروتكشن، يعني دايما
perfect.
نقولها مع الستيرويد. بس نقطة الانفكشوس دايريا اللي قالها دكتور باسم is very important. حتى لما بنقول الستيرويد مع MS after excluding pseudo MS flare، بنقول الستيرويد مع IPD after excluding infectious diarrhea. if you did not appear as a safe person while using steroid, يعني it might some examiner really take it seriously. Plus the complication تبع steroid, we avoid them by giving PPI and bone protection, especially in those patients who might need long-term steroid.
Yeah, perfect, Dr. Hind. Anything else we missed? Dr. Hind.
ما شاء الله دكتور باسم، أنت أصبح لا يستطيع الإنسان أن يضيف أي شيء بعد التعليق تبعك. لا والله بالعكس، ما شاء الله كله يعني the comments whether from يعني the doctor who gave the case or you people covered everything. بس أنا اللي كنت بدي أسأله، did you mention الuveitis بالآي بي دي؟ Even if it is ulcerative colitis, really they take uveitis as an important extraintestinal manifestation.
She asked about
Yeah,
vision. Yeah.
يعني
Yeah.
خلاص that's it. usually we forget the eye manifestation، يعني we concentrate on the source, mouth source. Sometimes it can affect the back. When we ask about
Joint, yes.
joint, yes, it's very nice if we ask any joint pain or any back pain, looking for sacroiliitis, which is usually a common association with the IPD. يعني that's it. Yellowish discoloration for the PSC. That's it. يعني don't usually are major extraintestinal manifestation for the IPD. But otherwise you people really covered everything nicely. الله يعطيك العافية.
Okay, thank you, Dr. Hind. Dr. Salma, you have any question? Yes, Dr. Ala.
Yeah,
Dr. Mahjoub.
yeah, hello. Good evening, everyone. Actually, Dr. Salma, she did great, but to me, I felt like she missed the diagnosis until the surrogate remind her, my friends, when they came, they have, but they improved. At that time, she put the main the main diagnosis. What I want to say here. Sometimes they will give you hint like a distractor, like here, traveling history in this case, like a distraction from the main diagnosis. And to be honest, I felt you distracted already by this traveling history, because you did not check these points mentioned by Dr. Hind, because you did not put in mind at that time that might be inflammatory bowel disease. So as I felt in while I'm listening, I felt like this. So at lately, when you get that one, then you start to go to the right track. But also the concern, I want to comment on the concern. No need to reach the diagnosis to inform the surrogate or the patient. Yeah, and you need to address the concern. First, you said to the patient that you have infection or something like that. Later on, when he telling you like that, then you change from that one to inflammatory bowel disease, and then you proceed. So it is better for me. You said you can be uncertain. If he asks you, you can say, we still now we are uncertain but we have some probable causes like this. What we need to do, we need to admit you, we need to proceed with blood test, and then with some imaging, then we will give you with full plan. It will be you are like already addressed the concern. Otherwise, you did great.
Yeah, perfect, Dr. Mahjoub. Suppose also to comment on her concern answering. Never ever give in these details. Try to be short in your answer, because whenever you are talking more, you will have mistakes. So be short in your answer to the surrogate. Try to be very target to the point. What he asks, you have to answer. Don't tell him I will, and I will, and I will, until he asks you what you will do for me. Okay. So there is possibility for other. Yes, there is possibility. What is it, doctor? Make it as a conversation, not as information. Okay, you're not here to give the only information. You are for the concern. You are here to listen to him and to answer him. He give you two concern, and for the 2 minutes you explain lengthy. So give him chance to express what he want to say. Is it cancer? Maybe he will ask about cancer. You didn't give him the chance. Be short as much as you can in the concern, because they have a lot of concern, and the instruction from examiner, please give her a lot of concern. Check if she can tolerate and she can answer all and she can manage these concerns. Okay, take care of this point. Thank you, Dr. Mahjou, for reminding
Okay.
about this point.
Okay,
Thank you.
thank you.
Yes. Okay. Any other comment? There is Dr. Tahani mentioned diarrhea as jargon. Yes, whenever you are talking to the patient, you can say loose motion. However, diarrhea is known already for all of people, but be more simple while talking to the patient. Usually say loose motion. The differential we mentioned already, traveler diarrhea, or you can say irritable inflammatory bowel disease before the traveler diarrhea, and traveler diarrhea. The last will be cancer. Colonoscopy, yes, you have to mention colonoscopy as one of the investigation tool, invasive one, to confirm our inflammatory bowel disease. Okay. Any question? Any comment? So it's clear for all. GI Day. Dr. Ala already have done the case of acute hepatitis, or sorry, it was Cadbury syndrome. I want to add this. I remember during the discussion of second scenario, I remember one of the very important differential you can put in the first scenario. Acute fulminant hepatitis due to paracetamol overdose. You have to specify a question for this. If she has history of medication, paracetamol, she said, so you can ask, did you take it as overdose, or did you take any over-counter medication? Why it can present with the same as acute fulminant hepatitis with the jaundice, and the patient will be also planned for transplant. It's very serious to be a case and you miss it. If you miss a case of paracetamol toxicity or the acute fulminant hepatitis because of paracetamol, you might minus they might minus you in the all point, the all skills. So be careful about this part of acute jaundice. Paracetamol with the tender liver is very important presentation. You have to put it in your mind. And you can put it in the differential and you can say, against that, no overdose or no paracetamol ingestion. Okay?
Okay, Dr. Bassem.
Yes. The second case was about the diarrhea, acute diarrhea on top of chronic. And the history travel was distracting. However, it's distractor, as Dr. Mahjoub said, but it's still one of your differential. They are not putting only to distract you, to put it in your differential and how to deal with it, how to manage it. Is it something to skip and to overlook it, or to put it in your mind? I should roll out some of the infectious diarrhea. Yes. So you have to roll out the infectious diarrhea, then to think about the previous or the original disease, which is inflammatory bowel disease. Okay, last question, Dr. Ashayma, infective diarrhea versus inflammatory bowel disease for yes, this is our differential today. In particular, infectious diarrhea, you can say traveler diarrhea. Okay. Thank you, Dr. Salma and Dr. Ala. Anyone
Thank
has
you, Dr.
question?
Bassem.
Thank you so much. Any question before ending the session? Clear for all? So we can.
Thank you very much, Dr. Basim. Thank you.
Yeah, most welcome, Dr. Salma. So wish you a good day. See you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.